Hi, my name's Darren Schneider. I'm a vascular surgeon in New York, and I'd like to welcome everybody to our webinar today, Pandemic in Practice. And this is a webinar series for medical professionals and their teams that's being brought to you by Gore Medical Products. And I'd like to thank Gore for doing this and for inviting me to moderate, and then all the panelists that we have today, which I'll introduce everybody to in a little bit. Gore is hosting a series of webinar sessions to cover various aspects of the impact of the COVID-19 pandemic. And today's session is going to be focused on how the pandemic is impacting physician wellness. I do want to point out that this webinar is being recorded, but everybody who's attending the webinar will remain anonymous, so don't worry about that. So today we're going to focus specifically on how the pandemic is affecting physician wellness. And today we'll have the panelists and hopefully the participants come in with questions so that we can discuss how COVID-19 is impacting physician wellness, and so that everybody can provide their insights in how to navigate the extreme pressure, stress, and anxiety that we're dealing with during this pandemic. We're also going to discuss opportunities where we as professionals can take opportunities to lead within our institutions, not only to continue to provide high quality care for our patients, but how to also support our colleagues during this pandemic. Before we jump into everything, I just wanted to mention a few housekeeping items. Most importantly, on the Zoom conference, there is a question and answer button that you have access to. And if you want to send in any questions for the panelists, we'll try to get to them during the course of this webinar and answer them. And these can all be anonymous as well, especially with regard to this topic. I think that that's important, that you should all feel welcome to send questions in to all of us. With those housekeeping things being said, I'd like to now introduce our panel. We have a great panel today. Dr. Albert Wu, Dr. George Everly, Dr. Nimesh Desai, and Dr. William Cobb are all here to join us. And during this webinar today, I think that we all know that we've been facing extreme stresses during this pandemic, new stresses, and how this is affecting us individually, but also our families, our colleagues, and also our patients. And I think this is a really important webinar so we can discuss those issues and perhaps some strategies with how we can all help each other deal with these. So with that said, I'd like to let the panelists introduce each of themselves. Albert, how about you start for us?
Hi, I'm Albert Wu. I'm an internist, but I sit primarily in the Johns Hopkins School of Public Health. I do incidentally have an appointment in surgery, which was conferred to me by Dr. Julie Freischlag, a vascular surgeon, when she was our chief here. I've studied the impact of medical errors and other traumatic events in physicians for my whole career, more or less. I came up with the term second victim, which has entered the lexicon a little bit. And I co-direct a program called RISE, which we'll hear more about. It's a peer support program for healthcare workers. I've been working during COVID in our command center to help coordinate staff support, and also with a coordinating group that includes Dr. Everly. So very happy to be
here. I think that's, we're glad to have you, and I think that's a good segue for George to go ahead and introduce himself.
Hi, George Everly. I'm a neuroscientist and clinical psychologist. I have joint appointments in the School of Medicine, School of Public Health at Johns Hopkins. My areas of interest in research and practice have been post-traumatic stress disorder, psychological trauma, stress, crisis, and since 1979, I've been studying disasters, disaster mental health. And this is actually my third perspective, my third pandemic. This is certainly a challenge. And from a mental health standpoint, we want to see what we can do to support, especially healthcare providers.
Great. Next, let's have Nimesh go ahead and introduce yourself and maybe speak a little bit to your experience with pandemic issues and your interests in wellness.
Sure. So my name is Nimesh Desai. I'm a cardiothoracic surgeon at Penn. This area, as it consumes this issue, as it consumes the world, is one that I have a close relation to, just having been in Toronto during the SARS epidemic and the original SARS epidemic 17 years ago, and being sort of very on the ground as a trainee at that point. So I've been working very closely with the team here at Penn, really on the data science side, trying to understand, what is happening and how to predict where we're going, from here. And as well, obviously very clinically involved in our response to this current pandemic.
Fantastic. And last but certainly not least, Bill.
Hey, thanks, Dr. Schneider. My name is Will Cobb. I'm the chair of surgery at Prisma Health Upstate in Greenville, South Carolina. Privileged to represent approximately 125 surgeons across 13 different disciplines. We have 35 residents and fellows and 100 medical students a year. So just represent a large group of surgeons that are trying to deal with this crisis. We've been fortunate, obviously, in South Carolina not to be as affected as our colleagues in the Northeast. But there's still a lot of apprehension as we start returning to whatever normal is going to mean in the future. And I just want to thank Gore for the opportunity to be on this panel and be with these true experts. And I suspect I will learn more than I will contribute, but I'm definitely looking forward to this. So thank you.
Great. Thank you all. So with that, let's get rolling. And I think that we're going to start first by giving the audience a poll so we can kind of judge the temperature of what's going on there in our communities and what people are most concerned about. I do want to reassure everybody that the answers to this poll are being maintained anonymously. So you can answer however you feel, and don't worry, nobody's going to attach a name to your response. And while we're getting some of those poll answers submitted, let's dive into our topic a little bit. Physician wellness and topics of burnout have been, important issues for a while now in our medical communities, and also being addressed at the society level as well. I know both Nimesh and Will have been involved in wellness efforts in their own societies and their own communities. So Nimesh, why don't you tell us a little bit about how you've been involved in that?
Sure. So
years.
Yeah, so I think part of as we kind of understand what is happening during this pandemic, I think the thing that, we've felt, most acutely in many ways is the loss of relationships to our colleagues and the people we work with every day. And there are actually a lot of resources within our society to help us work through that. At the Society of Thoracic Surgeons level, there's a whole host of different things that have been put in place to help surgeons try to understand how this pandemic is affecting them, to try and support them. It's actually, the website itself has a lot of things right on the front page right now that are readily available resources to try and provide a context, to the surgeons in areas where maybe this doesn't hit that hard, but is obviously affecting the daily life very significantly. And also some really practical guidelines in terms of just how to get through your regular day, and just things like setting routines, having goals, taking breaks, doing self-care, understanding how to talk to patients and families when there's a lot of negative news going on, understanding how to interact at home with your own family when every aspect of human life has been taken over by this pandemic.
Yeah, and well, you've been providing leadership for a very large surgical department. And so you're seeing it across multiple different specialties and in practice as well. So what have been your observations on this issue of wellness, and some thoughts on, the importance and how we need to address it?
Nimesh brought up a great point. I mean, it's the lack of connection and not being physically intact with your partners. I mean, you take that for granted every day. You see people walk in the hall, see folks in the lounge, in the OR, and you try to keep a sense of the morale of the department. I mean, I feel like that's largely the role of the chair, is to kind of have the finger on the pulse of the department, and that's largely been gone and been very difficult in these times to try to at least reach out to folks that may need assistance and are struggling. We've put together some groups that we talk every night just to try to keep that personal connection. But I think that's incredibly important to recognize that's been lost in all of that. There's a lot of resources, as Nimesh mentioned as well, and good and bad. I mean, we certainly have multiple societal recommendations and requests, and not all of those can be always met. But you certainly have to take all those into consideration, because a lot of it's based out of fear. And the ENT physicians in particular have just been devastated, because this virus is obviously so prominent in that area. So we've had to really hold their hands, I think, a little closer and tighter through this whole ordeal. But lots of resources out there. Obviously, the American College of Surgeons, and then the daily blog for those of you that are part of that community. It's kind of nice every morning to wake up and see a lot of comments from colleagues across the country and what they're dealing with. So just trying to stay connected and see what else is going on around us.
Yeah, I think those are really important points, that lack of connection, and I'm not sure that Zoom is a substitute for the way things used to be, but at least we're trying things to stay as connected as we can under the circumstances. Maybe we can see if we can have the poll results put up, because that might be an interesting thing to look at here. So the question was, what are the main drivers that have had an impact on your mental health or wellness? And people were allowed to pick as many as they want, so we can see what's going on. I think the two winners here in most votes at 41% were the poor lack of work-life balance and limited physical activity. So as I scroll through this, risk for infection for those around you, lack of productivity, financial insecurity. I don't think that those are things that are unique, even in the medical field. I think that we're all feeling those things. So I think that that's important to notice, that the same thing that people who aren't in the healthcare profession are feeling, that we feel as well as healthcare professionals also. Albert and George, maybe the two of you have a lot of expertise in looking at the impact of traumatic events and crises in healthcare and outside of healthcare on professionals. What are your thoughts looking at that poll and thinking a little bit based on your experience as to what you'd like to point out to our audience in terms of what people are feeling? What should they feel? Is there an expected course of what we should feel or go through? Why don't you jump in and give us some insights?
Well, I'll speak to the poll. Maybe George can talk about some of the reactions, but
Sure.
A good proportion of our audience, I would reckon, are or have been athletes at various points in your careers. And I really view surgery as being a little bit of an athletic endeavor as well. It takes physical prowess, but actually really being on your game, being able to focus, being able to create when you need to, and follow the rules the rest of the time. And when you are distracted, distressed, worried about your own safety, concerned about things outside of work, but that necessarily we all think about, it is very likely that you are not going to be able to perform at the top of your game, just like any athlete might. And so there are studies that show that people who are distressed and who have various, who are affected by various kinds of emotional trauma are more likely to make errors. In addition, when people are really feeling unwell, they may need to take time off, or they may, some people are actually opting out for sitting out for a period of time. And this can really affect the health system's ability to deliver its mission. The health system really needs to maintain its workforce at the time when it's working beyond capacity. So it's also very important for health systems.
From the perspective that I come from, I've studied disasters in 39 countries on 6 continents, and very, very, very different things. And the agents are certainly different, but what's fascinating is the psychological trajectory in the wake of such events is similar. And this is really good news for clinicians and public health planners especially. It's very good news for those of us trying to develop support programs for healthcare providers. Out of the study of psychological trauma, the natural corollary was the study of human resilience. Consonant with what we've already heard, the single best predictor of human resilience is connectedness to others. So we developed actually a formula, a 4-variable formula to predict the psychological toxicity of any given agent or event, whether it be disaster, critical incident, whatever. Across my studies since 1979, I have never seen anything score higher. No disaster has scored higher than this pandemic. And one of the reasons is that even though portions of the equation have been perhaps higher with other disasters, in no other aspect, in no other disaster have I seen the resilience component eroded as it is in the pandemic. The things we do to save lives, which are necessary, which is the quarantine, the social distancing, et cetera, we must do those things clearly. But inadvertently, we erode the very thing, the cohesion, the connectedness, the synergy that gives life to human resilience. I do want to comment on the poll. There's an interesting term on your poll that says work-life balance. One of the things that I've done is study special forces. We discovered that human resilience in special forces was bifactorial, two variables. One of the variables which was really important, which you would probably expect, is the cohesiveness, the unit cohesion. But the other variable was expectation. They had an expectation of success. They had an expectation of what they would be confronting. Returning to the notion of work-life balance, I will suggest to you that is an illusion. We had this notion that work was in one silo and life, if you will, was in another silo. I would suggest that we throw away that notion. We set a different expectation. How about work-life integration? And all you have to do is look at people who are now working from home, providing childcare services, elder care services, doing whatever they normally do at home, all within the same cocoon. And we are trying to do it in a psychologically dense environment. So the world has changed. We need to look at this issue through a different lens. History can inform, but this is new. We've never faced anything like this. And we also know, to Albert's point, we know that there will always be more psychological adversity in the wake of a disaster than physical diversity. To use another term, there will always be more psychological casualties. And what I mean by that is anybody who can't function at a level at which they would expect or hope to, than physical casualties. If we know that, and we can now project the trajectory of these things, we can tell where we are in the psychological aspects of the disaster. But most importantly, we can better assign resources to the different phases. The right intervention at the wrong phase is not going to work. So we've gained some insights. Now it's just a matter of applying it.
Yeah, really, really interesting. And I think the things that really stood out in some of what you were commenting on is, I think what we're all dealing with, and the reason that this is so having such an impact on all of us, and so different from a lot of things we've faced. I mean, we face stresses every day doing surgery and procedures and taking care of patients, but I think it really is that we lack control, and it's new and it's unknown. We don't know where it's going, and I think all those things combined are what really make this a significant challenge for us individually and us also collectively in our practices. Nimesh, what sort of impacts are you seeing kind of as a result of COVID that you're feeling, either individually or that you're seeing with your colleagues at Penn?
Yeah, I think that, it's, I think probably the biggest single, if you're going to use one word, is this is all consuming. This is, I can't think of a scenario where a tremendously challenging problem in the hospital or at work is also tremendously challenging, in your home, and tremendously challenging, in your neighbor's home and your families. And, these are all things that I think create a level of discomfort and distress that have been really, tough to wade through. As a surgeon, I think, we always start off by feeling like a lot of us, I think, feel like we're only really happy when we're operating. And in situations where that's not happening, it's hard to actually feel that sense of balance in your life. Like, why am I here? What am I doing? Our surgical team here at Penn ended up kind of being very involved in other ways to try and help out in this pandemic that kept us pretty busy, including, starting procedure teams to help the ICU doctors. And we actually covered the cardiac surgical and surgical ICUs ourselves to give our intensivists a break. So we ended up doing a lot of night coverage and things like that. Although that started to relax now that, at least in Philadelphia, the things are in a steady, they're not really decreasing, but they're in a steady, manageable state. But I think for those who have families and young children, this is taking a toll on them that is difficult to deal with as well, because you don't have a lot of control over it. I have a 6-year-old son, and he hasn't played with another child other than his sister in 2 months. I can't imagine what it's like going through something like that. So there's a lot of professional challenges. But I think that the combination of that plus the massive impact in your daily life at home is what makes this so difficult to really get through, and creates that level of discomfort and stress that kind of feels like it's omnipresent. It never really goes away.
Yeah, no, we're all dealing with that, and because that's right, it permeates every aspect of our lives. I mean, my daughter's a high school senior, and I can't imagine having my final year of high school, affected in this way. I have a lot of memories from when I graduated high school. She'll have a lot of memories too, but they're going to surround a pandemic. But we're trying to get through it together and support each other. Well, you've been facing issues in a major leadership role as well. I mean, have you been able to develop systems or approaches, or have you modified things to deal with some of the things that Nimesh was pointing out in our practices?
Yeah, I mean, it's really difficult to take a group of incredibly intelligent, highly motivated folks and essentially put them on the shelf, and they're itching and raring to go, and we, for a while there, we didn't know how the pandemic was going to impact us. It did give us a little bit of a release because we felt like we're going to be able to help out and provide our services for dialysis catheter placements and ICU coverage, and providing relief to our critical care colleagues at the COVID hospitals. But none of that really ever took place here. I mean, again, fortunately, we avoided a lot of the large numbers of patients that were feared and that you guys saw in the Northeast. And so, other than just, special things we did was just really trying to keep the connection. I mean, obviously everything was done via Skype or video conferencing. It did not replace that personal interaction. I have reached out and called certain select individuals in the department, typically the folks that are a little bit more of the rabble rousers when times aren't rough, and just to kind of see how they're doing and checking in and, making sure that there wasn't anything, that they needed, or if they needed assistance, needed to see employee assistance or even a psychologist and talk to somebody about the concerns they were going through. Another big segment as well, which I think we hadn't really touched on yet, is the learners. The residents have been through difficult times as well. I mean, I'm sure a lot of uncertainty about what this means for their training. Does it impact the numbers in terms of a case log? Because it's kind of what we live and die by as residents. And so, there are resources there. And of course, our program directors reached out to them. But we've had to go to very small teams for fear of, if someone got infected, taking out a large number of them. So that's had a significant impact. And then our medical students, we sent them home, which, we're training our future workforce, and in the time of a crisis where they should be learning and on the front line, we told them to go home. So I'm not sure that was a necessarily effective way to handle them. And I can understand for safety reasons, but just a lot of things I think are going to have far-reaching impact that we're not really considering currently.
Well, I think that it's been outstanding so far, but I think we've really getting a sense of the impact and the various things that we're all feeling. And I think we need to talk a little bit about, transition into talking about what we can do. What are the wellness resources? What are the approaches? And what are the things that we can do to help ourselves, our families, and our colleagues and our patients combat some of these issues? Before we do that, I think we have another poll that we can put up. I think it's up here now, where we want to see what everybody in the audience has in terms of access to wellness and or mental health resources at this time. And so while this poll's up and while we're getting all the answers to come in, before we take a look at that, maybe we'll talk a little bit about what is available to help healthcare providers and to navigate the pandemic both inside and outside of the workplace. And maybe, George, you can share with us some tools that you're familiar with and resources.
Yes, be happy to. So I think one of the most powerful tools that we have in healthcare is one another. And admittedly, we've been talking about that separation. But one of the things that is very useful, for lack of a better term, is we'll call a peer support program. What I'd like to do is have Albert describe the development of the RISE program at Johns Hopkins, and then perhaps I could follow up and put it in a bigger picture. Albert?
Sure. So at Johns Hopkins, we've had a program which has run for about 10 years. And it is a group of volunteers, very multidisciplinary, nurses, doctors, social workers, chaplains, and others. Interestingly, not that many psychiatrists or psychologists. So this is an untrained group, a group that has been trained to do really psychological first aid, to patch things, to come immediately when called. The group is on call 24/7 and responds to calls within 30 minutes and meets with people who need to talk to somebody. This has been moderately successful. We have typically gotten several hundred calls per year. But during COVID, we've been getting that number of calls, per week. And what happens is that people basically feel better when there is someone who can support them, really listen to them, and allow them to ventilate. This idea of psychological first aid is something that George has studied for decades, but this group has seen over 2,000 people in the last 6 or 8 weeks, and has really been an invaluable part of our response to supporting healthcare.
So what I'd like to do is put that in the bigger perspective, if I may. A lot of healthcare institutions have been consulting with us because we have been publishing for several years on what we do for healthcare providers from the psychological standpoint. So I recommend a four-prong approach, basically. I think it needs to start, and it's the lowest hanging fruit, so to speak, to set up the peer support program. Consonant with what Albert said, training is important. Psychological first aid training is imperative. Despite our well-intentioned motivation, our compassion, we actually can make things worse. So we recommend some formal training in psychological first aid, which the RISE team had before it was launched. So that's one aspect. We also recommend, and we've implemented at Johns Hopkins, crisis leadership training, crisis management training. And we identified two bodies of leaders, the policymakers at the very top and the people that shape the culture, which is the frontline leaders, unit managers. And we've developed a program on simple tips for effective crisis management based on some research my colleagues and I have done for several years. We've been able to identify 4 simple characteristics that are highly effective in cultivating an organizational culture of resilience. If you'd like to read more about that, you can read the IOM report on Ready and Resilient Workforce that was published in 2013. So those are 3 of the elements: leadership at the top, crisis leadership at the top, crisis management leadership training, frontline, the peer support, and lastly, self-care principles. We are dealing with people who are very much control-oriented, and I don't mean that in the negative way. I think it's a good thing. But what happens when control-oriented people are put in situations where there is uncertainty, where they are out of control? This is not a familiar feeling to people. And one of the most important things we can start doing to regain this sense of control is take care of ourselves. So there are some things that we can do at the personal stress management level. When I teach these concepts to special forces or law enforcement or people like that, we actually call it psychological body armor, because there are things that we can do that can actually psychologically, and I use this term liberally, immunize people, and there are certain things that we can do to foster the rebound or resilience. So again, a 4-prong approach is what we advocate.
Why don't we put up the answers or the responses to the poll? And so I think this is really important. People were asked if they have adequate access to these wellness and mental health resources, and it's not an overwhelming agreement that they do. I mean, most of it somewhat agree. But I think fortunately the people who disagree or really feel that they absolutely don't have access is relatively small, but maybe it's not as refined as it should be. What's everybody's thoughts or impressions about these poll results? I guess it says we have room for improvement.
I think the art form is first identifying the resources that are available. And secondly, and this is where it gets tricky, integrating them. And I think at Hopkins, again, we've done a uniquely well initiative in the sense that we have EAP, we have wellness services, we have chaplaincy services, we have the peer support RISE team, and we have psychiatry. And what we've done is we've aligned them on a continuum. And basically the umbrella is the Office of Well-Being. And we have been able to align the resources on this continuum in such a way that we use them most efficiently and effectively. Psychiatry plays an essential role, but it is at one part of the continuum, so that the psychiatry department is used for certain sets of circumstances, the RISE team for certain sets of circumstances, chaplaincy services, the EAP. And Albert could describe this continuum perhaps a little better than I.
So, I think that I'm tempted. I'm tempted to describe it in more detail, but I think that I'm captured by the question on the poll of if you have these resources available to you. And while they may be available, a well-known fact is that doctors in particular are very hesitant to take advantage of anything that sounds like counseling or therapy. No one thinks that they are in need of those things at any point. It's the patient who's got the problems. And, and I'm tougher than that. The work that George and others have done for over 4 decades have suggested there is a really predictable trajectory of how people will respond during a disaster, how they'll respond emotionally. The first phase is one that we're well through, but Bill described it. It's sort of the initial impact, and there's a lot of anticipatory anxiety. And then that gives way to a heroic phase when everyone's pulling together. You're doing things, you're actually working with colleagues that you had not previously. It's kind of exhilarating in a frightening way. And emotional well-being can actually increase briefly. But then after the adrenaline runs out, after a couple of weeks or months, you enter a long disillusionment phase. And I believe that is where we really are now. Now that you've done those things, you're faced with the fact that you're not working, you don't have your colleagues. In New York, people are exhausted, and there's still many, many deaths. And this is when people begin to get more cranky, more irritable, more cynical, and more depressed. This is a time when there may be suicides, actually. This is maybe the time. And this is where we should anticipate that as this phase continues for months, at least, that people are going to need help to recover or to recover faster. And I think that it's, if we think about it as normal behavior, that we're all going to be affected, and most of us could benefit in some way from some, I don't know if it's help or if it's self-help or if it's just taking advantage of the fact that there are ways to get better faster, get back to work faster, then I think that we will recover faster. I think if we are as stubborn as we tend to be, then no matter how many resources are out there, we may not use any of them and not benefit.
I think that was great. I mean, you perfectly described the range of emotions that I've gone through in the last couple of months here. So it really does hit home. And I think probably for all of us, and I know that myself included as a surgeon, I try to play the tough guy, and I have a hard time even admitting to myself that that maybe things aren't as good as they are, or are going to be hard to get through. So, is that a really important thing here? I mean, is it really that insight or that education, so that we all can acknowledge if we're dealing with something like this?
Well, I think that it's crucial that we admit it first to ourselves, and that we come to the realization that we can benefit. I think that checking in with yourself every day and then sort of trying to identify how you feel. Again, I think physicians and surgeons are not always the best people at doing that. My wife often says to me, you need to go exercise, which means that I'm being cranky and really need to get out of her hair. But we've started in our command center, which has 50 people meeting every day. We often start with 5 minutes of mindfulness meditation. And initially, a lot of the folks who are the top leaders in the health system and are tough men and women, were sort of rolling their eyes and checking their email. And then gradually people just acquiesced and did the relaxation for just a few minutes and actually relaxed. And then when people came back, you could see how people just looked a little bit different and held themselves a little bit differently. and something as easy as realizing that you too can benefit from some of these very simple resources is important.
If I can just follow up with that, Darren.
Sure.
I think information really is power. In my career, dealing with high-profile, high-power people, my experience has been they don't want to be taken care of, but rather they want to be told how they can take care of themselves. So the continuum, the phase model that we've developed, I think is very powerful if it's utilized properly. First and foremost, it says, this is what we expect. These are the phases we expect to go through. So from a planning standpoint, we can allocate resources. So when we know we're going to enter and are now entering the disillusionment phase, that's when most of our resources psychologically should be applied. The goal in this phase is to shorten its duration and steepen the recovery curve. Being informed says, no different if I go to my physician and I've got something, chest, cough, and I say, well, how bad is this going to get? When am I going to recover? And when am I going to be able to go back to work or back to the gym? And forewarned is forearmed. So these heuristics not only allow us to most efficiently and effectively use our resources, but it empowers people as well. And that's why these models, if they are indeed approximations of reality, can be so powerful and empowering.
Okay. I think that as we go through the phases that have already been described, I think there's a lot that we're going to continue to go through going forward as we get into what we may call the new normal. Some of us are entering this recovery phase. Maybe Will and also Nimesh can talk about, some of the apprehensions with resuming practice and how that may weigh on leadership and also, colleagues and the troops, so to speak.
Yeah, if I can sort of reiterate and add to some of the other comments, like one of the things that I think we've found, most helpful in all of this is having good leaders. Having a division chief that actually takes the time every week to get everyone in the division, all the faculty on a Zoom call, and just talk about what is going on and giving all of us a voice to express whatever it is that whatever concerns we have about lots of things, like our practice, like our income, like our connection, like our feeling of actually being relevant anymore. So I think that part of it is really important, and it's not something that you necessarily have a lot of control over, but for those people who are division chiefs and department chairs, taking that time in this process means a lot, and I think we've all benefited from having good leaders here. In terms of trying to get, looking at the future and looking at trying to get our practices moving again, there's all kinds of obstacles. I think you'll find every practice and specialty has its own issues. We initially and are using this MENT score algorithm to sort of calculate, which cases we think should be done earlier or sooner, based on the acuity of the patient, the benefit to the patient, and the amount of resources that they use. But it became apparent to us, at least in heart surgery, really quickly, that all of our patients score really high because the acuity is high and they use a lot of resources. So we've actually come up with, our own in-house metrics of what we think, is appropriate, and then, fighting to get the resources we need to get to do those cases is complicated, but I think that's a very local issue.
Well, how about you with the recovery effort?
Yeah, and I think it's important, like Albert said, we're at a really precarious time because even though we're presumably over the bulk of the infected patients hitting our institutions, as we start to go back to normal, you're asking again, a very highly motivated group to accept a change, right? And you know how much surgeons love change. And so I don't think our quote normal or our new baseline will be anything like it was before. We're going to have delays out of safety for patients and the team. And so, surgeons are going to have to demonstrate some self-awareness, emotional intelligence, whatever you want to call it. They're going to have patience with our OR staff, going to have to show empathy as well. And we don't always excel at that. And so it's going to even, further test our abilities. And so I think there's going to be a lot we face moving forward. I mean, we're going to have financial stress, crawling back to baseline. I think we're all fortunate that we work for a large institution, but, folks in private practice that have got to pay the staff. I mean, there's going to be, significant conflicts that they face, staying safe while at the same time generating revenue and taking care of their patients. And so it's, and then you fear, my gosh, if we do have a second wave or another concern, or we see peaks in cases and we have to back off of this, I can't imagine what that would do emotionally to my department. I mean, that would be devastating at this point, and we haven't seen it again like the Northeast. So,
go ahead, Albert.
I was going to say, I love what both Nimesh and Bill were saying about how strong leadership can help carry the department. And I think that it's an example of stand together or fall apart. And it's not just that there are a few weak surgeons or a few weak practitioners who couldn't cope. It is really abnormal if you're not having some anxiety and fear and worry. You might want to check up on those people to see what's, check to see if they've got an adequate pulse or something. But I think that pulling together, as George was saying, that group cohesion will allow the group to succeed. And perhaps, again, surgeons are a special group who have a lot of strengths and who are, sort of not quick to admit the few frailties. And I think that it's really only the chief or peers that can normalize that, say not only is it okay, but it's normal. I feel the same way. Here are some things that we're going to do together. Here's some resources that we can all avail ourselves of. There isn't a top athlete in the world who doesn't have a sports psychologist to coach them so that they can be that much better. And I think that something like that could come into vogue for the departments of surgery and for health systems, because it's hard to believe that we couldn't get better faster. So how are we going to do that?
Yeah, no, I think that everything mentioned so far, I think is spot on, and I think that I think leadership is critically important, and I want to mention something about that. But I think also every individual paying attention to taking care of themselves is also important too. So I think you gotta get enough sleep, you gotta eat okay, you gotta try to get some exercise so you're taking care and looking after yourself going through this. And for me personally, I think also trying to set some sort of routine, even though nothing is normal anymore and things have changed, at least, come up with a list of things or a schedule for the upcoming day, even though it's not what our normal routine was, and that's been helpful. And I'll have to say that at our institution in New York, even though, we were seriously impacted here and still are, that leadership from the top down has been really important. Leadership has been visible. They have communicated. They have gone out of their way to express that anybody having an issue or a problem or noticing something that needs to be addressed, they're happy to address those things at our department level and within our own vascular division. Monday through Friday, without fail, 8 a.m. every morning, we have the entire team on a Zoom call, and it's the entire team. It's the residents, it's the fellows, it's the PAs, it's our office staff, as well as the physicians. We probably are seeing each other even more than we did all as a group during the pre-COVID times. But I think that's been really important because we transmit information, we make sure that everybody is aware of what's going on, and that you know, even if it's a little square on a computer screen, that we see each other's faces once a day. And I think that that's important. I think Nimesh was speaking to that, Will, as well, of making sure that we're reaching out, we're getting people together, and we're maintaining that line of communication.
Yeah, you know, I think that I used to sort of dread, you know, all of the different invites to, you know, conference calls and things, you know, especially being involved with the STS database and TVT and a few other things that, you know, you end up getting, you know, 8 hours of conference calls a week and on top of your practice, and you know, you dread it. I actually look forward to seeing people's faces and talking medicine and surgery now. You know, it's actually been very helpful to do a lot of that stuff.
Great. Well, I think that as we get towards the end here, we have one more poll. Can we have that put up? This poll specifically is asking what would be most helpful to your mental health and wellness going forward. And lists a variety of options there. I'll let everybody read through that. And then we'll go over the results. But while we're doing that, there's a question here that came up from somebody in the audience here asking about, you know, are there any positives that have actually evolved out of this? Is there a silver lining, so to speak, that we can take forward even after life returns to some, you know, semblance of normality? Maybe it'll be a new normal. Maybe we'll get back to normal one day. What are people's thoughts about that? I think we were mentioning kind of developing some ways to communicate that are new, but what are other people's thoughts on that?
So I would have a couple of, I would have a couple of general pointers, and maybe again, this is where leaders, but also each of us individually can sort of reflect on some of the things we are actually doing better now. I think that we are all being just a little bit more understanding and patient with each other. You know, I always say that if someone says something to you in a tone that you don't love, you can understand why that might be. We're all under stress, and if you could, you know, sort of not, if you could just sort of suck it up, or if you could even ask the person, "Gosh, you know, I'm feeling pretty stressed myself. How are you doing?" If we could be a little more understanding and considerate, and perhaps a little bit more constructive when we have suggestions or criticize each other. I think those practices could benefit our whole practice of medicine. And I think a little more appreciation for all of the people who are not quite so visible, some of the staff, some of the non-professional staff in particular. I think we actually appreciate them more now. We're more likely to see them on a Zoom and actually see what their names are. And I think that, again, is also good for group cohesion.
There's another question, or a follow-up question, is to, and maybe you deal with this in the RISE program as well, but how do we as colleagues look at our peers who struggle to cope with things, and do we act sympathetically, or do we feel that they're being weak or slacking off? And you know, how do we avoid that? And is there a way of recognizing that, or a system to approach that?
So I think there's this terrible thing that we have in our culture, at least it's at Hopkins, it was at Cornell, it's in most big places, and that is people perceive that asking for help is showing weakness. It's a sign of weakness. And that couldn't be further from the truth. If you're someone who's supervising a young practitioner, asking for help at the right time is, you know, what is necessary to allow things to go well. And so we have to try to change that. And when people ask for help, identify that as a sign of strength and self-awareness as opposed to a sign of weakness. Perhaps even call it out and thank people or compliment people publicly for admitting the things that at this moment we're all feeling. So there should be no shame in asking for help.
Yeah, I think that that's important. I mean, that's part of the culture of surgery and a lot of different healthcare specialties, that stiff upper lip, don't complain, just suck it up and do your job kind of approach to things. And I think that for a long time now, we've sort of recognized that there's been a lot of emphasis on wellness through our societies, focus on physician burnout. And I think that has been an emphasis in that it's not a sign of weakness to reach out and to ask for help. That's important, that you need to lean on your colleagues and don't keep it to yourself, because, we do see, God forbid, we've even seen it during this tragedy where, a physician has taken their own life, and we never want anything to come to that. I mean, you definitely should use your colleagues and ask for help. So I think that what you were pointing out there is so vitally important. We don't want to see anybody hurt more than they need to be from this pandemic. That's for sure. We have one more question here. How do we think that this is going to, do we think that this is going to lead to more hospital-employed physicians, or the impact on academic versus private practice, or large group and hospital-employed practices versus private practice? I mean, maybe, Will, you have some thoughts on this as well in your position in South Carolina?
Yeah, I've wondered about that. Certainly I think there's more of maybe a sense of protection when you're a part of a larger employed group, but that might be a false sense of security. I know, we employed some cuts throughout the department just because we're all productivity based, and we were going to, either get hit at the end or take it on at the beginning so that it wasn't so large. I've heard of other institutions as high as 20-30% pay cuts. So I'm not sure that we've all been necessarily immune to that. But, again, just trying to relate that to my department in the sense that, you still have a wonderful job. You're still very well paid. You're not worried about putting food on your table, where a lot of our community is suffering in that way. And so, again, there's, been sort of an empathy and having to have an understanding of our patient population better. I think that's maybe been a positive out of this as well. And then, I got no complaints when we framed it that way. So I could see that on the surface, but I don't know, maybe it provides a little more financial security, but I'm not wholly convinced that's true.
Maybe go ahead.
I'm sorry, I'm reminded of something Charles Darwin said. He said the groups of people that are most cohesive and most flexible, not necessarily the most strong, but cohesive and flexible, are the ones that do well. So coming out of this, I'm reminded of the notion that crisis can sometimes be viewed as a dangerous opportunity. There's also a corpus of literature on something called post-traumatic growth, that one can actually come out of something stronger. It's come out of a crisis stronger. I think that can apply to people. I think it can also apply to healthcare systems and the way we do business. So I have no doubt, I may be naive, but I have no doubt that things will be different. I think that difference will provide unique opportunities for those that are cohesive enough and flexible enough to recognize them and move toward them. So out of even some of the really worst things I've seen in 39 countries, I've also seen remarkable recovery and growth from it.
I think that that's great, and that's a great way to wrap this up. I'd like to just see, does anybody else have anything else that they've seen that maybe has been, inspirational and that we can lean on? I mean, maybe to what George was talking about. I mean, I think that what I've seen in the heat of battle at the peak of the crisis here, it was inspiring to see people come together and do great things, take care of each other and patients. And I think that we have developed some systems of approaching patient care telemedicine, things like that, that are new things that we've, really evolved rapidly and really integrated into our practice during this pandemic. And I think that some of them are actually going to be durable and lasting. And so for me, seeing goodness in people and seeing some of the things that we've put together that may be lasting and may have a beneficial impact on our practices going forward is at least, some silver lining for me. I mean, this is a terrible thing, and we're all dealing with stuff. We need to take advantage of the resources. I think that that all the things that were pointed out here today on this webinar were incredibly important. Just as we're wrapping up, I just want to share with everybody, I have a slide here with some resources. And I think that this is really important. If you're really struggling and think that you need help and are not sure where to go, you need to reach out for help. And on this slide here, we've listed some resources. Certainly, if you have any thought that because of the stress that you're going through that you've ever entertained, that you might, harm yourself, please seek help right away. And there are some links here and resources that are available to everybody. So if you don't have what you need right with your colleagues or your institution, or don't know where to go, take advantage of these resources. We don't want to see anybody hurt by this. We're just about out of time. I would like to thank all of our guests, everybody on the panel who took the time out of their day to join us here today. This has been a webinar series dealing with the impact of this pandemic on our practices. This was the third in a series of 4 webinars. So next week will be our 4th and final webinar regarding the COVID pandemic. And this is going to discuss what we call pandemic pivots for things that we may want to keep in the future in our medical practices based on the experiences that we've all gone through. And I think this will also be another exciting webinar. We've got an international panel who can bring us some insights from other parts of the world who may have gone through phases of the pandemic that we haven't even gone through ourselves here in the States. So with that, I think we're out of time. I'd like to thank everybody again and wish everybody well. And don't forget yourself and wellness.
Thank you, Darren.
Thank you so much.
Thank you, Darren.
Thanks.
You're welcome. Thanks.